For our presentation, we decided to touch on the subject of informatics in nursing. Informatics in nursing have become an integral part of the nursing field. Nursing informatics can include things such as documentation on the electronic health record, and what we are going to touch on today is the importance of patient portal, how it can help or hurt the nursing field, and some of the pros and cons that we will go over in this presentation. Nursing informatics is something that a lot of nurses don't really realize what the background is and how important it can be for the nursing field. We oftentimes don't even second guess what we're doing with our handheld devices to administer medication or the importance of documenting in the electronic health record. This was something that was implemented not only to help the nurses, but to assure that there will not be any confusion between shift changes. When you can go back and look at what the previous nurse has charted, this can be an important part of the nursing care, not only to assure that you have the right patient, but to double check the orders and to make sure that you are doing the correct procedure and following the orders for this patient. This is also a wonderful way for the nursing staff and the physicians and everyone else in the hospital to be able to keep track of the changes and communicate on the information that is needed for this patient. As important as the electronic health record is for the nursing staff, we would like to touch on how important the patient portal is for the patient and their family to be able to keep track of lab results and other test results that they need to help with the process of healing.
So what is informatics in the healthcare? Nursing informatics is a specialty that integrates nursing science with multiple information and analytic sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in the nursing practice. Nursing informatics facilitates the integration of data, information, and knowledge to support patients, nurses, and other providers in their decision-making in all roles and settings. This support is accomplished through the use of information structures, information process, and information technology. The goal of nursing informatics is to improve the health of the populations, communities, families, and individuals by optimizing information management and communication. So pretty much everything you do in the nursing world is touched by nursing informatics, whether it's a study being done and the results being interpreted, or your assessment being charted, or the patient being able to look at his medical record online, also known as patient portal.
How do informatics affect healthcare? Informatics help to ensure patient safety remains at the forefront of care delivery by guiding a user experience design. Nursing informatics specialists are the translators that have evolved into health tech innovators. They establish businesses, manage medical economics, create technology, and amplify the voice of end user clinicians, meaning they basically translate between healthcare and the public. Nursing informatics are constantly curating, researching, and presenting a detailed analysis that goes beyond the acronyms that premate our ether. So they help develop the systems in a lesser term and shift the culture of how we practice medicine to one that is safer and more efficient and patient-centered. So nursing informatics help to center care strictly around the patient by making documentation easier and not taking so much time to write everything by hand and having more time to focus on the patient. The electronic patient portal is a potentially powerful tool to facilitate self-management and support for patients with chronic illnesses. However, patients are not always taking advantage of this resource. This is something we as nurses need to think about and ask ourselves why. Do we just need to put more teaching on how to navigate our systems? Building a sustainable health information technology infrastructure has been a broad goal in the United States in the most recent years. Seamless flow of information within a digital healthcare environment has the potential to transfer the way we care and helps us to focus more on the patient than what we need to be documenting.
So now we're going to talk about patient portals. When was the patient portal introduced? Patient portals were introduced and adopted by a few large healthcare organizations in the late 1990s. However, patient portals did not gain widespread use until 2006 when several initiatives coincided, including the launch of electronic patient health records by Microsoft and Google.
What is some of the information that patient portal can contain? The patient portal can contain a clinical summary to the patient after each visit. This helps so that the patient, if they didn't understand what was being said at the time because stressors or what the diagnosis was during the clinical visit, they can go back and look to see and help to clarify and ease some of their stress. It also helps with secure messaging between patient and provider. This can help so that everything is documented. This helps us on the side of letting know that there's documentation that the patient asked this question and this is how we responded. Also, it has the ability to view, download, and transmit personal health record data. This can help the client when they are going in between different hospitals or just getting a second opinion on what their diagnosis is. Along with being able to download, there is patient-specific education. This helps the patient to look back and see what they need to be doing exactly for their diagnosis, or what are some ways that they can help to prevent further spread of the diagnosis and to help reduce risks. Along with that, there are patient reminders for preventative services. This is something we all need. We all get lost in the hustle and bustle of the day. This can be very helpful for those that just need a little reminder that they have an appointment. Also, they have medication reconciliation so that everyone in the system can see what medications they're on to double check and make sure that there are no overlaps or medications that can contradict each other. This can also help the patient to organize their medications for the day.
How does patient portal help or hurt the healthcare process? It could help by lowering healthcare costs if a patient is able to communicate with their provider before the issue becomes a bigger problem, or even if a parent is able to message their pediatrician or provider over a patient portal about their child being sick instead of rushing to the emergency room when sometimes that's not always needed. It could hurt by not allowing for that face-to-face connection with a provider. If you're just seeing a screen for care or messaging them the entire time, you're truly never building like a trusting relationship with your provider. So, pros of the patient portal. Age. So, younger, I would assume it's easier and sometimes better for those who don't like calling, who like texting or messaging better, which I would assume is most of our generation, or I guess your guys' generation since I'm quite older than you guys. A really neat study we found was done amongst adolescent and young males about the use of patient portals for HIV and STI reporting, questions for providers, education tools, and even having the possibility to share with their partners. 1,228 males from the ages of 15 to 25 participated in a survey that had questions such as if they found it would be easier to manage sexual health records, if they would be willing to share their information and their results with their partners, and if patient portal would increase their confidence in sharing those results with someone. These results were wild. Over 90% of the participants agreed that access versus non-access to patient portals were more convenient for managing sexual health records, would encourage people to be more aware of their sexual health, and would aid in making better sexual health decisions. Similarly, over 90% believed that patient portals could improve their communication on HIV and STIs and would be more confident in HIV and STI testing information a partner shares with them through the patient portal. Approximately 97% and 78% of participants were willing to use patient portals to share their HIV/STI test results with main and non-main sexual partners, respectively. So I feel this type of response shows that there is a want and a need for patient portals, even if it's for something as simple as being able to show someone a test result. So now we discussed the younger, let's talk about the older. We assume it's harder for elderly or older patients to use patient portal because of the technology. But one study conducted among elderly who used or wanted to learn how to use patient portals showed that patient portals can benefit older adults in managing their care as well as their family givers managing it. Despite some doubts about older adults' ability to use patient portals, many older adults actively use it and value their helpful functionings, such as medication management, laboratory results review, and communication with care teams. Another pro, I guess we should add, is some people get really nervous talking to those nurses and doctors. So use of patient portal provides them with less anxiety to view those results. They don't have to call in and they don't have to go in person. They can just do it by themselves, so it lessens their anxiety.
So now that we touched on the wonderful pros of patient portal, here are some of the cons that we found. We didn't try to dig too hard because this is a great thing for us to use. But one that got touched on is it might not be secured Wi-Fi and your patient portal couldn't be hacked. A study was done to see what kind of protection was needed to make sure patients were safe when looking at their portals. Specifically, something called a crawler was looked at. A crawler is a program that is designed to look for certain things among a website. They can even pretend to look like a human being through a portal, so it is often hard for programs to block them. While I could read to you about specific software they tested and their crazy names I won't be able to pronounce, I will just tell you that they do have a special software that learns how these crawlers work as they move through the website. And it's pretty crazy to think a robot of sorts can learn exactly how you act as you are moving. So as this might be a con in general, just know that patient portals are actually pretty safe and secured. One other con that we found is that it doesn't allow the patient to get as much contact with the nurse or doctor. This can almost cause the patient to feel like there's a lack of compassion and you aren't really able to connect with the patient or the provider to talk about these feelings that you may have about the diagnosis or the test result that you are finding. This is something so small and minute that we might not even think about it when we are able to have that person-to-person contact when talking to a patient about their results. We would like to think that technology is the best way to go, but sometimes giving results in person is the best way to do it, so you are able to be there for the patient to help understand their feelings and help talk them through the possible diagnosis that they just received.